Hello, everyone, and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP, and today we are going to talk about depression in a simple, clear, practical, and not too boring way. Because let's be honest, depression is already heavy enough. We do not need the explanation to feel like reading a medication package insert at midnight with no snacks. This lesson is for PMHNP students, psychiatric providers, and anyone who wants to better understand depression, what it is, where it comes from, how it affects the brain and body, and how we treat it. By the end of this video, you should be able to explain depression in a way that a patient, a family member can easily understand. We will talk about what depression really is, how it shows up, what happens in the brain, psychological and social root causes, medical and substance-related causes, treatment options, nutrition, vitamins and supplements when depression becomes an emergency. Short disclaimer. This video is for education only. It is not medical advice, diagnosis or treatment. If you or someone you know is struggling, please seek help from a licensed professional. In the U.S, you can call or text 988 for the Suicide and Crisis Lifeline. Now, let's get started. Part 1. What is depression? Depression is more than just feeling sad. Everyone feels sad sometimes. You can feel sad after losing something or checking your bank account. That is part of life. A simple way to explain depression is this. Depression is like the brain and body getting stuck in low power mode. Imagine your phone is at 3%. Apps are slow, the camera won't open. That is what depression can feel like internally. The person may still look fine on the outside, but inside they are running on emotional battery saver mode. Here is the first provider pearl. Depression is not laziness. It's not a lack of faith. It is a real condition that affects the brain, body, thoughts, and relationships. Part 2. Depression is not always visible. It doesn't always walk in wearing pajamas and crying. Sometimes it walks in wearing scrubs or a 4.0 GPA. Common symptoms include sadness, loss of interest, sleeping too much or not enough, eating too much or losing appetite, low energy, and feeling worthless. A patient may not say, "I am depressed." They may say, "I am tired, I cannot focus, my body hurts, or I feel numb." We assess the whole picture. Normal sadness says, "This hurts." Depression says, "Nothing will ever get better." Sadness is an emotion. Depression is a condition. Part 5. Neurological causes. Think of the brain like a busy airport. Depression is like the system getting backed up. Delayed flights, low fuel, foggy weather, and stressed out air traffic control. Serotonin helps with balance. Dopamine helps with motivation. Norepinephrine helps with focus. When these systems don't work well, the brain-body system struggles. The prefrontal cortex is the brain's CEO. When depression affects this area, a patient may stare at a pile of laundry like it is a mountain expedition requiring a passport. The amygdala is the alarm system. In depression, it's like a smoke detector that goes off when you make toast. The alarm is real, but the danger may be exaggerated. Anhedonia is when life's volume knob gets turned down. The song is still playing, but the patient cannot feel the music. They stop enjoying hobbies and music. The body releases cortisol for danger. But chronic stress makes cortisol a permanent roommate. It's like an emergency fire alarm that rings all day, pushing the brain toward depression. Genetics is like the soil. Some soil grows depression more easily under certain weather, but soil is not destiny. With the right care, people can recover. Part 10. Psychological causes. Depression is like wearing dark sunglasses indoors. It changes the story you tell yourself. It's a terrible lawyer, but it argues very confidently. Trauma puts the nervous system on guard duty. Depression happens when the guard has been standing watch for too long without rest. Ask, what helped you survive? Part 16. Social causes. Humans are wired for connection. Isolation is a risk. You can have 2,000 followers and no one to call at 2 a.m. That is an audience, not connection. Provider. Pearl. Always screen for bipolar disorder before starting antidepressants. Ask about periods of high energy and low sleep. Do not skip the mood history. Treatment is not one size fits all. It's like tailoring a suit for the brain. We use CBT to fact check depression's fake news and behavioral activation to start small. Antidepressants don't work overnight. It's not like a light switch. It's like planting grass. You water it consistently before you see the lawn. Discussion of SSR is and SNR is. Lifestyle treatment gives the brain better fuel. Don't tell a patient to just exercise. Start with a mailbox mission. Walking to the mailbox is a win. Feed the brain like it matters. Omega-3s, vitamin D, and B vitamins support neurotransmitters. But natural doesn't mean safe. Watch out for St. John's wort interactions. Depression is an emergency when there's suicide risk. Ask clearly and directly, are you thinking about ending your life? Shame closes the door. Validation opens it. Depression makes the brain feel stuck in a dark room. Treatment helps open the windows. You don't have to fight it alone. Thank you for watching. I'm Dr. Ben Osevwe.